Welcome, everybody. I'm going to kickstart this Hyperchat, the second of the Hyperchat series that we've been organizing at ZN, looking at how the world is changing with COVID-19. And today we're going to look at what I think is probably one of the most critical conversations that we're going to have as a society in the coming months. And it's around the vaccine for COVID-19 and the conversation taking place on social media around vaccination. Something we've been working on for many years, for over a decade. And some of the people that we've been privileged to work with are in this call. For me, the really core of the question is, what is COVID-19 going to do to the vaccine conversation? Is it going to make the anti-vaxxers more aggressive? Is it going to lead to more vaccine hesitancy, or does everyone want the vaccine and will it go the other way? So that's a little bit of one of the questions I hope we can address in this hyper chat. We have a fantastic group of panelists as well as people on the call. And I'm going to be introducing them a little bit more later, but we have Gary from Ireland, Jane from Toronto, Bram from the Netherlands, and Leora and I are in Brussels. But we have people really all over the world listening in, which is at least one advantage of these online discussions. So I will pass it on now to Leora to talk a little bit about hypermoderation.
Yes, definitely. I would like to invite you to be an active part of this discussion today. First of all, if you have any comments, put them in the chat. And also, I would really like to know who you are. So if you could tell me who you are, where you're from, where do you work, and put that in the chat and just say hi, and then we would love that. Also, if you have one question you would like the speakers to address today, what would that be? Feel free to drop that into the Q&A. So in general, questions into the Q&A, any other thoughts, and also share with us who you are into the chat. Also, of course, if you'd want to follow this event on Twitter and continue the debate also after this event, you can do that using the hashtag Hyperchat, and please also tag ZN Consulting so that we see your conversation. So hashtag Hyperchat. So I would like to start with just asking you the first question in a poll, just to get a feeling of the crowd. So the very first question that I'd like to ask you is, will COVID-19 weaken the anti-vax movement? And you can start voting right now. I'll leave it open for a little bit and we'll see the results after the first speaker. I still see that a lot of people are voting, so I'm still going to leave it open for you. Will COVID-19 weaken the anti-vax movement? Yes, no, or maybe you're just not sure. Yes, no, not sure. I think people are done voting, so I'm going to end. Oh no, people are still voting. I'm going to end the poll now. And we will share the results after the next speaker. Thank you very much.
Thank you. So you just met Leora. For those who don't know, Leora works at ZN and is in charge of hypermoderation, which is connecting this conversation with the online world as well as with your chat questions in this particular space. I'm Phil Weiss, I'm the CEO of ZN, and I'll be moderating and introducing our speakers. And to begin with, we're going to go to Ireland, and we're going to hear from Gary. So Gary Finnegan is a health journalist. He's a journalist by background. He's actually got the award for the EU Health Prize for Journalists 3 years in a row. So congratulations, Gary. And he's been working on vaccines today for about a decade. So he's really very much aware of the vaccine conversation. And he's been himself at the receiving end of anti-vax campaigners. So he lives on the front line of the social media conversation on vaccines. So Gary, I mean, you've seen this conversation, you're very aware of COVID-19. So if you can tell us your thoughts on how do you think this conversation is evolving, what do you think is going to happen next?
Thanks a lot, Phil, and thanks very much for inviting me to take part. Yeah, I think my answer to the question is probably a long one, in the sense that I don't know if I can give you a yes or no, but that's okay. I have 5 minutes. But I think it's definitely changing the conversation, and I'll explain kind of what we've seen on vaccines today in the recent couple of months. Just to cast our minds back, as you mentioned, Vaccines Today has been online for 10 years. And if you go back to around 2010, you may or may not recall that there was another pandemic at the time. It was H1N1. And just about every review of that pandemic pointed to communication failures. That ended one also, saying that the conversation on Twitter and other platforms had started out relatively neutral. People wanted information. But over time had shifted into the negative territory. And part of the reason we've always felt is that at that time, pro-vaccine voices were not present. So we've been trying to do our bit to change that. Back then also, conspiracy theories abounded, especially in the vacuum that was left. And we're seeing a new breed of conspiracies at the moment. It was around that time that the anti-vaxxers were finding their way onto social media platforms, but maybe the rest of us, some of the experts, authorities, industry, governments were a bit slow. Also, the social media channels had quite a laissez-faire approach at that time, and we can talk later on, I'm sure, about how maybe that is beginning to move as well. So generally on Vaccines Today, and especially the Twitter channel that I would be on day to day, we're definitely seeing increased activity, that's for sure. We're seeing new people who suddenly have a strong desire for a vaccine, for information, for a solution to escape the lockdown or the changes that we've all had to live with. I think some of the milder vaccine skeptics have gone quiet. They're either shifting away from complacency that had driven their anti-vaccine feelings, and now they're a bit more worried about the disease itself. Just a quick primer, lots of you probably know the 3 C's of vaccine hesitancy, but it's complacency, convenience, and confidence. We talk a lot about confidence, about whether people trust vaccines, but complacency is a big one, and it's always been a problem that people don't see measles because of vaccines. Suddenly they're seeing an infectious disease and they're wishing there was a way to stop this from happening. So that's on one side. At the other side of it, I think the hardliners have gotten harder. They're more convinced than ever that vaccines are a scam. There's a film called Plandemic that's been going around that suggests the whole thing was invented either by industry or governments or whoever you feel like victimizing Bill Gates. Probably doesn't feel like a victim, but he's been on the receiving end of lots of this. And there are also worries about the new potential vaccine. And I think some of those are a bit more legitimate, in the sense that you can understand why someone would fear that an accelerated development program could mean a shortcut. And I think we have a job to do to explain why that's not the case. And of course, it's important that it's not the case, first and foremost. The interesting thing I've found lately is that the anti-vaxxers have company now. They've merged with like 5G conspiracy theorists, others more, especially in the US audiences, libertarians who want to end the lockdown and have other agendas. And so there's an interesting reshuffling happening there. If I had to guess which wing of the anti-vaccine group had lowered their volume, it's probably the green, better off super parent who was worried about toxic chemicals and wanted a natural upbringing and so forth. They're now a bit more worried about the disease, about COVID-19, and maybe it's given them pause for thought. We've seen anecdotal stories in the media about this, people saying, right, okay, maybe measles or maybe flu and meningitis and so on are more worrying than whatever they'd read about diseases. Maybe later we'll talk a bit more about social media, but on the tech side generally, it is kind of a real-time exercise in how to handle, a proper worldwide outbreak, and to varying degrees they're taking on some responsibility. I did a little experiment last week, and I set up a Twitter handle called Corona vaccine, I think I called it. And it was shut down by Twitter in 24 hours. And I had only posted, I'd retweeted and posted some really innocuous stuff from mainstream media and from scientific publications. And no, I had breached the rules. So they're definitely on it. At the same time, we see things like the Plandemic movie going around. So it's hit and miss, so it's not perfect. I guess the big question, to come to your initial opener, is will this last? So on the tech side, some of it probably will have a lasting legacy. On public attitudes, I think it's a much more difficult thing to say. The pandemic definitely blows a hole in the complacency that we had seen. Now people appreciate the diseases are real and there's demand for at least one vaccine, although it doesn't exist. We have to look at, as others might say, that how to convert this into demand for other vaccines, including those that affect similar risk groups. The only caution I have about the whole thing is that we talk a lot in vaccine hesitancy circles about various cognitive biases, that make us believe weird things sometimes, all of us. But one of them I read about recently was projection bias. Projection bias is the tendency to imagine that your current feelings and your current preferences will always be that way in the future. So I'll never feel like traveling again. I'll always want to work from home. I'm going to take a more slower, greener, healthier life from now on. We've come a long way in 2 months, but I think we should be cautious that it can all be undone just as quickly. So just to conclude, I think if we want to take the good parts out of this and sustain those, we have to build networks that will serve us well in the future. Keep conversations about prevention going, encourage people to think of their role as individuals in a community. So people in the various, flatten the curve campaigns have seen themselves contributing to public health in a real way. And then to educate really about specific things like the R number of viruses. So coronavirus maybe infects, say 3 or 4 people or 2.5 people on average, but measles infects about 18 people if there's no vaccine. So these are messages that maybe we can springboard from. Anyway, those are introductory thoughts, let's say, but I think it's changing things dramatically, but we can't presume it'll be like this forever.
Great, thank you very much, Gary, for getting us started. And I think, this is all about trust. And the question is, do we trust the information that we're reading on the internet? And I think this affects everyone. And how can we make sure that we're actually finding the correct information? Because that's the beginning, I would say, of a positive conversation. So Leora, I'll go to you first to check whether you have any comments or thoughts that you wanted to share with us from the web or from the chat.
Yes, we have a question on Twitter. Hugh is asking, he says, there are anti-GMO activists who are now pushing the anti-vax narrative. And Gary, what do you make of that?
That's one of those interesting realignments. Maybe that had already begun. I would say there was some overlap between the the kind of suspicious anti-science, anti-industry, anti-government groups. Plenty of people in the anti-GMO group probably do vaccinate, and I'm sure the same is true otherwise. But there's a strong overlap. And then, as I said, there's a new sort of cross-fertilization into the anti-5G crowd who are suspicious of these mobile phone masks. I think a lot of the things that drive anti-vaccine sentiment also drive the other anti-science movement.
Yeah, and then I wanted to welcome people who have shared who they are, people from student organizations, also people from Canada, from IFA as well. Of course, we have Jane, and so there are other people from IFA also joining. And So I wanted to thank everyone. And I also wanted to point out that if you wanted everyone to see your comment, then to make sure to share it with all panelists and attendees so that everyone can see it. Otherwise, only the speakers will be able to see your comments. Perhaps now is a good time to share the results of our poll, and then maybe Gary, you could respond to this as well. So the results of our first poll, I think you can see this now, is that most of you, 50% think that yes, COVID-19 will indeed weaken the anti-vax movement, but then there are others who say, well, no, or I am not sure. What do you make of this?
Yeah, well, it's a mixed view. Not everyone has the same opinion, and there's a good chunk of not sure. And I didn't vote because I didn't want to mess with the results, which I was going to comment on, but I probably would have said not sure, because my answer is a bit more, it weakens one part of it that was already a bit floaty anyway. But the hardliners have only gone more extreme. However, as we often say, we actually don't need those people to vaccinate to create herd immunity, even against measles or chickenpox. What we do need is for them not to dominate the online conversation. So yeah, the other thing I would say about that is that as they get more extreme, they kind of become self-defeating, because an average person who has a look and sees someone with a really far out view thinks, no thanks. But an ordinary person with skeptical questions who was anti-vaccine, that was probably more persuasive. Yeah, some of this is good news, I think. The madder they get, the better it is for me.
Okay. We also have a question on the Q&A. Philippe is asking, wouldn't it make more sense to have this discussion at the time we know the virus is mutating?
I'm not really sure. I think we should have it as often and as early as possible. I probably would say no to that, I'm afraid, Philippe, sorry.
All right, well, thank you very much. I think perhaps I'll give it back to you, Phil.
Yeah, so thank you for those questions. I think that, the conversation of vaccines obviously is about what happens with the COVID-19 vaccine, but of course, it's in a much bigger vaccine story that we're going to touch on as we discuss things with our panelists. We actually have somebody who agreed to make a guest appearance on this Hyperchat, who's in Geneva and is with VSN, the Vaccine Safety Net. This is Brian. So what I'd like to do is to call Brian, and if we can turn Brian into a panelist, because Brian is working on a very important field, which is basically how to communicate safe and reliable information on the topic of vaccines. So I'm going to check with my colleagues. Have we invited Brian to join us? Hello, Brian. Can you hear me?
Yes, I can. Thank you very much.
Thank you. So I'll pass it on to you. Maybe you can tell us a little bit about who you are and what VSN is about, and then what do you think will happen, which, as I said, is the million-dollar question or the trillion-dollar question now.
Yeah, well, thank you for inviting me. It's a great discussion already. So my name is Brian, and I'm attending on behalf of the WHO established project, the Vaccine Safety Net, in which Gary and Vaccines Today is a member of, and which I agree with everything you said there, Gary. And so our aim, our priority is to provide reliable sources of information on vaccines and vaccine safety online, which is readily accessible and identifiable to everybody according to their region and applicable to the scenario in their region and in their language. So to date, we have 88 members from 39 countries providing information in 35 languages. And so it was estimated that 2 million new users were accessing information made available by VSN members every month. And last year, some 72 million pages were viewed on VSN websites. And so, so each member has been verified by WHO against criteria that was developed by the Global Advisory Committee on Vaccine Safety, which is a WHO independent advisory committee. Once screened, each member will continually be evaluated to ensure they conform to best practices on things like content, scientific accuracy, design, and accessibility. So as a network, we want to encourage knowledge sharing and collaboration. And so the current pandemic is a global issue, which we want every country to be equally well informed and each member to be equally well equipped. And what we mean by this is that as part of the network, not only do we give you that visibility online as being part of a WHO project and vaccine safety net, but we have projects running where we provide insights and data analysis for the benefit of the network. And so in 2017, we started a web analytics project where Google Analytics data was analyzed from participating members. And this was to gauge how well performing we were, the reach and engagement, and identify areas where we needed to improve upon. We have since expanded this scope to include the measurement of social channels, social listening, and audience analysis. And so hopefully this will enable us to identify pockets of the population where our scientific-led information is not reaching and help inform the network on how to tailor communication interventions and direct them to where they're most needed. This was a pilot project that's just been completed, and we hope to continue this and roll this out. Vaccines Today, again, was included on this pilot program. And so a little bit on social media, because that was identified in the first web analytics project and something that we needed to have a presence on, because this is where the majority of misinformation was being circulated, and it wasn't governed as such. And the steps that we've been taken so last year, Pinterest made the decision to only surface vaccine-related results from leading public health organizations, and that included the WHO and VSN. And so our aim as a network is to establish these working processes with all the social media companies and make the information from our members available to them so that it becomes, reliable information comes from a wider source instead of just having it from, WHO or CDC or, AAP in this instance for the Pinterest.
Sorry, Brian, if I can just home in on a specific area of your work. So with the COVID-19 crisis, did you see a surge of searches around, reliability of information? And so how has that kind of affected that data? And what is your view? I mean, and I know it's a prediction, but do you think it's going to get worse or better in terms of disinformation around COVID-19?
Personally think we saw actually a flattening of the curve in anti-vax activity at the start of the pandemic, because it's much harder to argue against the efficacy of a vaccine when you're in the midst of a pandemic. But as Gary rightly pointed out, that community is opportunistic. Their motives are beyond wanting to share what they think is a genuine view, that they have a motive. And so we are preparing for the worst. We expect them to come back, and as Gary said, the ardent anti-vax have. And so in our work, what we have to do is prepare for risk communication and make sure that what we are saying is going to be relevant to the broader public and that it's going to be accepted. So, all these projects and analyses that we're doing is to prepare us for when a vaccine, if and when a vaccine is available post pandemic.
Thank you. So that's fascinating. I think you have an incredibly challenging, moment coming up, because I think communicating properly good information on the vaccine, the COVID-19 vaccine, which we don't know yet about. I mean, there's, the question is how quickly will it come out? How will it be tested? How will it be rolled out? Who will it be for? And we're going to talk about this with our next speaker. I want to turn to Leora for a minute on the polls, and then I'll introduce our next speaker.
Yes, so the result of the last poll, sorry, we saw this one already. Yes. So we're gonna go to the next poll. And this poll will bring us nicely to the next speaker as well. And it is about COVID-19 and ageism. Has COVID-19 brought to light deep-rooted ageism in our society? Yes, no, not sure. Has COVID-19 brought to light deep-rooted ageism in our society? Yes, no, not sure. Please vote and let us know what you think. And then we'll hear from Jane Barratt, what she thinks in a minute. Yes, no, not sure. Still voting, 74% has voted, 76%. Please vote. Let us know what you think about this. This is your chance. I think this is about all we're going to get. Thank you very much for voting.
Thank you. So I'd like to introduce our next speaker all the way from Toronto in Canada. And Jane is the Secretary General for the International Federation of Aging, but she's also active in the vaccine conversation. And she actually is working on making sure people understand how important this population, the at-risk population is, but also to make sure we don't discriminate and we ask the right questions. So I will now pass it on to Jane. Jane, are you there? And I'll pass the floor over to you. I think we need your mic.
Yes.
No, sorry, on and off again.
Okay.
Perfect.
Got me? All right. Thanks, Philip, and it's great to be with you and other speakers and many people around the world. You know, the question about ageism has come up time and time again with, you know, older people and COVID. But I just want to step back just for a minute and say that the IFA established a Vaccines for Life virtual platform, you know, to focus on, you know, improving the uptake rates of adult vaccination. You know, why did we do that? One of the critical reasons is because, you know, vaccination in older people don't seem to be high on the agenda of many governments around the world. Why are we involved in this? Because we know that vaccines and vaccination are one of the most effective public health interventions of our time. You know, it saves millions of lives every year. And, you know, when we think about this pandemic, I don't know whether people realise, but we've had 3 wake-up calls in the past: HIV, Ebola, and H1N1. So why haven't we learned? Why have we been asleep at the wheel in these pandemics? Because it has not affected every single country around the world, and it has not affected every single person. Whether it be big or small, every person is impacted. You know, we've never known these words, test, trace, isolate, until yesterday. You know, we've never known how many seconds we've got to wash our hands, you know, because that means that their hands are clean. And so when we come down to older people and vulnerable populations, why is it that in some countries, people who are 70 years of age, you know, do not get triaged into treatment for COVID, but a 50-year-old that's got cardiovascular disease, diabetes, and others, they actually get triaged into, you know, treatment. So ageism is very much part of this conversation that is happening around. But, you know, let's step back from COVID for a minute and think about respiratory diseases where we do have vaccines, you know, influenza, pneumococcal pneumonia, shingles. You know, they're available in many and most countries around the world, and yet the uptake rates are pretty much abysmal. So there's disparity from the WHO targets. 75% is the target for influenza, but 90% is the target for children. So that then is at the heart of this conversation about ageism, the way we think, feel and act about growing older. So let's also look at some facts. Where I live in Ontario, 7 out of 10 people who have died in nursing homes. 70%. Would we think that that was acceptable in so-called normal times? 8 out of 10 in Quebec. 50% of all people that have died in Europe are older people. Would we ever think that's acceptable? So then I turn it over to the conversation on social media. And it's a bit of a challenge to you, Philip, and others. When is media going to be responsible in the leadership of public good? We talk about vaccines being there for the public good. So when is media going to be there for the public good? Because we know that with all of these trillion and billion stimulant packages that are there now, austerity is just around the corner. And with austerity, it's funding cuts. And funding cuts are only going to go to the lowest common denominator. And guess what? And that's why we're fighting. We have to fight. You know, IFA is fighting, you know, to ensure that adult vaccination is on the agenda, because the investment in promotion and prevention dollars, you know, in OECD countries, you know, less than 5%. That's appalling. So have we woken up yet, or are we still at the wheel? My guess is that we're somewhere in between, because one of your mothers may have died of COVID, one of your sisters, your brothers, your children. We don't know. There's a lot that we don't know about COVID, and there's less that we know about an effective vaccine. So while we're waiting for this effective vaccine, and people are trying to sort out, well, where do older people fit in that queue, you know, for the vaccine? And my guess is we're not going to be front and centre. You know, we need to do the best that we can with the vaccinations that we've got. And we're seeing that happen now. But I can tell you, IFA is there fighting with civil society to ensure that there is parity and there is improvement in uptake rates of adult vaccination. So I'll leave it there, Philip, and I throw the baton over to you.
Thank you so much for that. And I think you're right. I mean, there's an incredibly difficult conversation that we have to have as a society, which is about, you know, what is the value we put on protecting certain kinds of lives? Is an older life worth more or less than a younger one if that younger one has certain preconditions? I mean, it's incredibly challenging moral dilemmas. And, you know, I think that the next question will be, if you have a limited a vaccine that's only available in limited quantities, who gets it first? Which is going to be part of the conversation. And I think what I guess is incredibly challenging is that these are conversations that need deep thinking and real proper discussions. And of course, social media is where things tend to go fast, tend to be simplified, tend to be highly emotive. And I think that, you know, we don't have a choice, because the conversation will take place on social media. I mean, for practical reasons, if anything. So we need to learn to have better conversations, to be more patient, more rigorous when we look at information. Before we share an article, you know, check the article, the source, think about what you do when you retweet something, because you might actually be changing, you know, somebody's life or somebody's opinion just because of what they read and who they read it from. So very, very hard questions. And I think, you know, this whole COVID-19 crisis has been all about how vulnerable the older population was. But what's incredible, and this is something that we'll also be touching on with our final speaker, is that this population has been at risk of the influenza for a much longer time. And yet there was no front page, no death count, no, you know, how many people went to hospital this year. And so I think there's a question of perspective and understanding of probability and risk, which again doesn't lend itself to simple 280 character tweets. I'll turn to Leora for a quick check on how we're doing with questions and comments from the broader audience.
Yes, Bear from the Specialist Nurses Association says that vaccine and vaccinations are also absent in the heart and mind of many health providers, and this is a void in the wider education. So this is something that he feels definitely needs to be addressed. So that's interesting. I also wanted to take you to our Twitter channel for a second, so that you can see what's happening there. Can you see it now?
Yep.
Right. So you can see that we're sharing what's happening in this Hyperchat live on Twitter. We have our social media team, which you can see here, turning the very interesting comments of the speakers immediately to content for our Twitter channel. Also, the polls that you've been so kindly participating in are turned into content. So if you find it interesting, please retweet and share your content, share your comments also on our Twitter channel. So thank you very much for that. Then maybe we share the results of the last poll. So, I'm so sorry. Keep showing the first poll. I'm going to go to the second poll, and this was: has COVID-19 brought to light deep-rooted ageism? There's not a clear view. Yes, 43% does say yes, but there are also many people who say no, or that they are not sure. So maybe we go to the third poll.
I think it'd be great to have Jane react to maybe that poll.
Yes.
Yeah, look, thanks, Philip. I think what we've got here with the COVID situation is, and my staff will laugh, you know, there's the intersectionality of ageism and race and socioeconomic status. So it's not cut and dried. We certainly see, you know, ageist attitudes, you know, boomer remover. But we also remember that ageism is across the life spectrum. Younger population are being known as vectors in the social media. So we've actually got to look at it across the board. And what we're really dealing with here at the heart of this is broken, inadequate and absent healthcare systems. We would not be sitting here talking about this now, about deaths, about, you know, if the healthcare systems were able to respond. But, you know, the preparedness hasn't been there. So we've got to look at this in the broader context. And just one final comment. We have lived with the moral and ethical dilemma of limited resources for as long as I've been alive and have not done anything about it. So, you know, when we have the conversations on social media, it's not only about vectors and boomer removers, it's about the policy implications. And I hate to say it, but policy sometimes is done on the run. And so, you know, Twitter being fast and furious, you know, it's not far short of sometimes how policy is put together. I wish we could be more thoughtful. So perhaps that's a takeaway message. Policymakers, be more thoughtful and evidence-based. Thanks, Leora.
Thank you very much. And I think this is a really very important point. And, you know, we're going to have to think very hard about these questions, these ethical questions. I remember reading Jonathan Glover, Saving Deaths and Saving Lives and Causing Death, which was basically the moral dilemma of, you know, if you have a train and you have to direct it to one rail that goes to kill 5 kids and 1 older person, and how do you make the calculation? Unfortunately, this is not theoretical. These are going to be real questions, and I think we have to be very honest about how difficult these questions are going to be. And we have to have these full conversations. And now I think with the pandemic that we're in, and as you said, this didn't come out of the pandemic, but I think it's massively amplifying the problems. I mean, they're going to be right in front of us, and we're going to have to say, as a society, who do you choose and why? And what do you want to do? And how do you make the investments in the future? And I think that the the moment that we're in is when all these decisions are going to be made that will affect us for the next decades, because we will make decisions about how to create a health system in the future and where do you help people and save them. So I think what you're saying is incredibly interesting, and it raises this thing about not oversimplifying. And we're going to talk more about how it's easy to get your facts and your statistics wrong just because of what you read in the papers. But I'll come back to Leora for our next poll of questions.
Yeah, so first of all, you get a lot of support, Jane, in our chat. People say, well spoken, Jane. And then Hugh says, I'm a boomer ready to be removed. As a 60-year-old, reckon my life is worth about half that of a 40-year-old and a quarter of a 20-year-old, and would like to see my taxes go on education rather than keeping me alive. So that is, that is Hugh. Thank you, Hugh, for that contribution. Let's go to the third poll, which I would like to share with you. Is COVID-19 a unique opportunity to change the mindset around vaccination? Yes, no, not sure. Is COVID-19 a unique opportunity to change the mindset around vaccination? Yes, no, or not sure. Please answer this question for us before we move on to our next valued speaker, Bram Palache from the Netherlands. Is COVID-19 a unique opportunity to change the mindset around vaccination? Is this a once-in-a-lifetime opportunity to change the way people see vaccines? Yes, no, or not sure. I think everyone who wanted to vote has voted, Phil.
Thank you very much. So I'd like to introduce our final panelists, and we're still going to have some discussions after this. Bram Palache. And I think he really follows from the discussion we just had with Jane about ageism, about how people understand vaccination, the hard decisions we're going to make. Bram Palache has worked in the flu space for many, many years, and he's one of the leading experts on the topic. So he knows about vaccination, about flu, and I think he's extremely well placed to give us his thoughts on, whether he thinks that it's going to be, how are we going to understand the COVID-19 vaccine in comparison to, for example, a vaccine that exists for the flu. So Bram, I'll pass it on to you.
Thank you very much, Phil, and also for organizing this webinar, which is a new experience for me. Very well spoken, Jane. I think that was a very fantastic contribution to the discussion. I want to talk a little bit about some of the observations I've made during the COVID-19 episode, and to support the idea that this is an opportunity, an ideal opportunity to change the mindset for immunization. Whether that will be successful or not, I don't know, but it certainly is an opportunity to put renewed efforts to educate people on immunization. There are some parallels for corona and influenza, because these are airborne infections which are not closely related to particular behavior. So that means that everybody can attract an infection. So we are all potential candidates to be infected. That's very important because that is the reason why we have these measures. If you look at influenza on a yearly basis, for the Netherlands, for instance, in 2017-18, we had 9,000 excess deaths just due to influenza infections in the Netherlands, 9,000 excess deaths. Today, we had a report from the government for the population every 14 days that we are now at excess death due to corona at 9,000. So that means that influenza, which occurs every year in varying degrees, but it occurs every year, is causing a huge disease burden, hospitalization and death. And it's more or less grossly speaking, the same risk population. People with underlying diseases, older people, they are the real people at risk for serious complications and death, both for influenza and for corona. But in contrast to corona, we don't see this, and you mentioned it, Phil, we don't see this societal interest. We don't have daily numbers of influenza hospitalizations or influenza death reported. They appear after a year or even longer periods in the national statistics, but they are not in our conscious. We are not aware on the degree of disease burden for influenza, whereas we are now very much aware of the disease burden for corona. As long as there is no vaccine, we all understand that there's only one measure, social distancing and all the derived measures to protect us. As long as there's no vaccine and also no treatment, there's nothing else we can do. And we accept that to protect ourselves, but also to protect the older adults and people with underlying medical conditions. We accept that we had the lockdowns, which we are opening up now, luckily, but to protect those people, there's huge investments. 8 billion, recently 8 billion has been collected for the development of coronavirus vaccines led by the European Commission. So we do understand that, I think everybody today understands that the final solution for corona is a vaccine. Whereas for influenza, we do have safe and effective influenza vaccines. They are already today. They are already there for 60 years, 70 years. The WHO and the pharmaceutical industry are working day and night through the whole year to update influenza vaccines and make them available. But what we also see is that many countries and many regions of the world, these vaccines are hardly used. So in other words, we are spending a vaccine to develop a corona vaccine, but the vaccine we have against influenza, that is not made use in an optimal way. So the question is, why do we consider protecting older adults and people with underlying medical conditions for corona, to protect them against the corona infection? Why do we perceive that differently than for protecting the same people for influenza infections? Apparently, we have different, we are just probably, but that's my speculation, we are just not aware of the serious impact of influenza. Now, if we're talking about social media and communication, I think these facts, these observations, which I find very paradoxical and relate to the ethical issues Jane was addressing. I think what shall I say? There is no ethical justification, actually, to discriminate between those two, because these are infections which is killing, and social media maybe can take the advantage because people much more understand today lots of the backgrounds of hospitalizations, critical care, surge capacities, and all those R0s, all those virological things are now very known to people. So maybe take influenza and refer to them in a way that people can understand more, and use that as a stimulus for uptaking at least the vaccines for diseases which we can prevent with vaccines.
Thank you. I think that was very interesting, and you're putting those facts that I don't think we realize, especially people who are not looking at these issues, which is, you know, we have other diseases, in particular influenza, and we don't have that conversation. And, you know, I think there's something that frankly, nobody really understood or is prepared for, which is this incredible overload of information on COVID-19. I mean, everywhere you turn, every social media channel, every newspaper is talking about, you know, the death count and how many beds and how many this and how many that. At which point you kind of think like, is there really added value of getting up to the minute information on this, when indeed, when we have these other conversations, we literally, it's as if we didn't care, which I have to say is a bit of a mystery. Now, I think, to come to the poll question, I do believe that there is an opportunity to change mindset, and I'm optimistic by nature. So I think it's also going to be a question of making it into an opportunity, because people are thinking about things they never thought about before. Now, before I turn to Leo for this, I want to come back to Jane on the question, you know, what Bram just raised. Do you think this lack of interest in influenza vaccination, is that part of this kind of ageism that you were talking about? Or do you just think it's a random thing that just COVID-19 just captured the media cycle and there we go? So now it's not rational, it just is, we've become completely absorbed by this. What do you think is the explanation?
It's never going to happen to me, Phil. You know, nothing ever happens to me. I won't get cancer, I won't get the flu. And if I get the flu, well, I'm healthy, so I won't die. So and that's human nature, isn't it? We're all immortal until we're not anymore. Mm. And so, you know, that is part of what's going on. But because COVID has been so in your face, and because we have real time, you know, real time everything, real time rude comment, real time integrity, real time, you know, it's always in front of us. But flu is almost like the comfortable bedfellow, isn't it? It's there. It happens every year, and some people die and some people don't. It's normal. But COVID's done this. And so that's why, you know, we, at the same time as we're talking about a COVID vaccine and the moral dilemmas, we actually have to start marching to improve uptake rates for influenza, because that is going to save people. Because if we have, you know, an increased, a hard season, you know, of influenza and pneumonia, there are no beds. The health system is blocked. So people being vaccinated means that there is going to be space when and if we have the second wave of COVID. So it's not complacency, but we're just so used to saying, it won't happen to me. But guess what? It happens to me. So I think that's part of the conversation.
Thank you. Thank you. I think, yeah, Bram, I'm going to bring you in because I really want to hear your thoughts on this. I was wondering, you know, this way of communicating about the epidemic might lead to us starting to look at influenza cases. You know, maybe in the next cycle, people will start looking at tracking and saying, okay, this is what happens, just because we now have a frame of reference. And the other thing, and I don't know, Bram, if you know this, but do you think social distancing and washing your hands and the things we're doing for COVID, will that have an impact on flu by lessening it?
I don't think so. I think the big difference there is that in flu, we have a community in society which is at least partly immune by previous exposures. So we are not in a virgin society. Otherwise, influenza would be more disease on a yearly basis. But that's only partly immunity because of all the continuous antigenic change of the influenza virus. We don't eliminate flu.
Right. Okay.
But Phil, we've got a bigger issue coming down the train track at us right now in the Northern Hemisphere, and that is supply and demand issues. We know that governments are scrambling to try and get enough influenza supplies for their population. So we're dealing with the COVID, we're dealing with influenza in the south, you know, supply-demand issues in the north. At the same time as trying to look at this moral dilemma and the fatality rates. So it's a really multi-pronged approach that's going on.
Can I add, bring in another element to this discussion? Because I've been involved over the last decade, now more than a decade, in global pandemic preparedness discussions for avian influenza, swine influenza, you know, the pandemics. And we internally talk about pandemic fatigue. It's just too difficult to get attention for pandemic preparedness. That's something which may happen, but in the far future, etc. So countries and governments and policies are just not prepared to make the necessary investments, whereas annual influenza immunization is a fantastic opportunity to prepare for pandemics, because that would give you the infrastructure. This will give you the production capacities. This will give you the experience and to learn from what's going right and what's going wrong and do better the next year, etc. So by the time there isn't in the future a pandemic, you will be much better prepared. Many of the things which shortages of materials, whatever, should have been part of a pre-pandemic plan, and whether that pandemic was corona or whether that pandemic is influenza or any other disease for the future doesn't matter. But if we are accepting a terminology as pandemic fatigue, and I think that is very, very difficult to overcome. And there is a circle there, because if you would take a decision to really invest in pandemic preparedness, get your systems right, etc., etc., and in immunization program, appropriate implementation of programs, then your level of preparedness and response is much better. You may not have a vaccine immediately, but at least you will have your infrastructure ready. So it's a missed opportunity, and I think if countries are more serious about that, then they would also be more supportive to support annual immunization campaigns. So there's a circle, and if they do support annual immunization programs, then healthcare providers will be much more stimulated to implement the recommendations. And therefore also people will take them more. So there are different stakeholders at different levels, but if you can find ways, and social media is, I think, could probably be an important part in this, is to motivate countries to be more serious, that you can break that negative cycle.
Great. No, I think that's a very good point. I do believe that after this pandemic, we will certainly be more prepared for the next one, which is, you know, a little late, but I think there's going to be obviously an analysis of the cost. Now, let's see what happens. At least I think now is the time to reflect on what we can do better to anticipate, but also better to manage this as part of a broader discussion on healthcare vaccination, which is why this discussion has to be, you know, really done carefully. Now, I want to turn to Leora because we have some questions, I believe, and some poll results. So tell us what's happening.
Yes, first of all, we have a question from the audience, and I thought it would be a good idea to bring David Zuruk in so he can ask the question himself. David, are you there? David is turning on his camera as we speak.
Yeah, I'm trying to turn it on and it keeps going off. Someone needs to allow my. Okay. Yes. Thank you. Okay.
Yeah.
Okay.
Hi, we see you,
Okay.
David. Hi, David.
Hi,
You had a question for whom? Did you have a
Yes,
question?
I have a question and a comment, I think, and I think one of my points is that as the risk monger, my role is to be a bit of an agent provocateur. So I hope I'll sort of spice things up with something which may challenge the pro-vaccine position to a certain sense. But the first thing we have to do is, I think Gary touched on it a little bit. And one of the challenges is that when we speak about an anti-vaxxer, it's a little bit like saying climate denier. What does it mean? You've got anti-vaxxers who are naturopaths from the chemical and anti-chemophobes. You've got the anti-industry people, anti-government conspiracy people, the 5G people, as you mentioned. But you also have medical practitioners who are concerned about certain adjuvants. You have concerned parents that are concerned about different types of vaccines. Does my child need a hepatitis B, or do they need, the varicella vaccine for chickenpox? And I think grouping them all together and taking all of their posts off of social media is not actually an interesting way to engage in debate with this. Now, if I can set the scene a bit deeper, 20 years ago, I was working on a communications paper for, at the time, Solvay Pharmaceuticals, which produced Influvac, the main flu vaccines. And in 2000, our recommendation was that if you're old, if you're vulnerable, if you have other illnesses, or if you're working with elderly or susceptible people, you should have a flu vaccine. We were not telling children they had to get flu vaccines. We were not forcing people to say you're going to kill your grandmother if you don't get a flu vaccine. And so after H1N1, after SARS, then there was that need to have a stronger communication campaign. But we also saw something else, a little bit of what I would call the vaccine vigilantes coming in, who basically would want to shut down any discussion at all or any questions. And sometimes when I'm on certain websites, including the CDC, I get a little bit nervous about the communication skills because I wonder whether we've created those demons. And if I could just give you one example of how that's translated into the COVID crisis, that's a little bit questioning for me as well, is when I hear people say social distancing is the only thing we can do right now. That's the only way we can stop until we get a vaccine. No, there are a lot of things we can do. Now, of course, the WHO tells us to wash our hands. Thank you. Okay, that's one important point. But viruses are fought and won in the immune system. And there are other ways until we get a vaccine. A vaccine is a very good way to strengthen your immunity. But there are other ways to strengthen their immunity, including simple points like eating well, sleeping well, reducing stress, cutting back on smoking and drinking. These are basic things that we should be telling people all the time, but we aren't. And we aren't because I think there's that certain sense that we have to let the specialists in and basically tell everyone to wait for a vaccine. So the vaccine vigilantes that are now very much closing debate and creating this sense that if you question anything at all about what's going into a vaccine, we're going to stop this conversation right now, has actually fueled this fire. So my question is quite simple, might be a bit provocative. Are we the ones who have created this beast, this monster? And how do we deal with it then?
Thank you, David. Thanks for that. I think a very interesting question, which I'll maybe give a chance to our panelists to share their thoughts on. I think because we've been working a lot on pro-vaccine communication, and I think the key to good communication, if you want to be a responsible citizen, is you have to go back to the science every time. And you shouldn't say, yeah, vaccines are always good. What you should say is, look, the science that we have in this case shows this, and that's where we make a decision that, based on an understanding of risk, you are better off taking a vaccine. But no, it's not like anyone, anytime can do it and it's no problem at all and you should just drink your detergent or whatever it is that some people are saying. It's something that you have to do based on facts. And I believe, and I think Jane was really making, to me, that point, which is we need to be smarter about this very difficult conversation. Which is every choice we make about which vaccine, who gets the vaccine, how it's developed. Is it developed? I mean, are they going to rush it because of the urge governments are saying we need it right now? And will that create a risk? Of course it will. If it goes too quickly, there'll be a risk attached. And I think we need to have this conversation So for me, we need to get deeper into this. And I think that it's not, I mean, if you're saying that anyone who expresses any doubts about vaccines should not get a voice, I think that's wrong. I think you need to have the conversation again and again and again. And we also need to check. I mean, there might, the whole point about science is that you might get scientific facts that show you that something you thought was true is no longer true. That's the whole point about a scientific debate. Now I see that Bram is reacting to this. So I don't know if you want to pick up that question, and then Gary. So Bram, you want to go first?
Yeah, well, I fully agree. I think we should not exaggerate what you may expect from a vaccine. You should provide information which is valid and correct, but nevertheless, the benefits of vaccines in general have been so broad and so important for society that we cannot, because of balance, take that discussion out of balance. But it has to be fair and evidence-based, sure.
Excellent. Gary?
Yeah, I mean, as David said, I mentioned that it is kind of a spectrum. There's different shades of anti-vaxxers, and they're not all the same, that's for sure. Yeah, a lot of them have just normal questions. For most people, they haven't thought about vaccines until they're told they have to inject their child with this mysterious substance, and they want to know what that is, which I think is totally reasonable. So I think we always have to have answers to those questions. I said at the start that I tried to set up this Twitter account about corona vaccine, and it was shut down, even though it was totally innocuous. So some of the censorship or the moderation is pretty blunt. But some of it's good, and it points you towards good information while still allowing you to look up whatever you want. So some balance there. They were talking about some of the vaccine vigilantes, as he called them. I actually agree partly with that. Some of the pro-vaccine, doctors included, can be almost as bad as the anti-vaxxers. They can get abusive, call people stupid, and lack empathy. And if you're dealing just with a parent who has a reasonable question, they need answers rather than insults. And then finally, I probably disagree with David a little bit on some of the other thing about healthy living. I think maybe authorities are a little afraid to be really blunt about it, but you do see some of them saying vitamin D, for example, increases your outcomes with COVID. And also, although they're tiptoeing around it still a little, it's obvious that healthier people are doing better, and obesity seems to be it's as bad as being in your 80s. So I think everyone is slowly taking that on board, and hopefully we'll see some behavior changes outside of vaccination that will make the population healthier generally. Yeah, I think, there's a point you make, because we had an earlier Hyperchat about social media. And one of the questions was, do you want Mark Zuckerberg to decide what's good information and not? And, that's the problem with the platforms, because they have so much power. So self-regulation does not sound like a great solution, but we don't really have many other solutions. So I think we're still trying to figure this out, because what you've seen in COVID-19 was Twitter, Facebook, YouTube putting these, little links saying, if you search for this, go there. And then also removing content, I think just, out of precaution, by saying, if in doubt, just take it out, which leads to also unfortunate conclusions. So I think social media is really, it's a problem to figure out how will you make sure that completely insane, toxic information doesn't continue to circulate. And I think we have to figure that out. There has to be some kind of liability. There has to be a way to say when something is clearly responsible. There's a massive gray area, and I think that one is very, very difficult to deal with. But on the science point, the doctors who are too extreme, I mean, I think like with every conversation, you're going to have people at both ends who will be unreasonable. And I think, to me, a good conversation, a scientific mindset, is to say, let's always go back to the facts. Let's always be willing to be wrong. Now, that's one thing. The other thing, however, is that what some of the anti-vaxxers, and there I mean anti-vaxxers as in, people with an agenda who are very aggressive,
will use incredibly emotive stories, visuals, and I mean, really, you know, deeply offensive pictures of coffins and things. I mean, everything that makes you deeply disturbed. And you have to challenge that. There has to be emotion on both sides. But ultimately, we also have to be, you know, not just propagandists, but actually also saying, okay, what are the facts that we have to go to? How do we tell that story? But how do we question ourselves to see, you know, where do we go from there? Jane, I want to turn it over to you.
Look, it was just a comment, and thank you, David, for your question. I just immediately go back to, my job is not to determine the origins of anti-vaxxers. That's not my job. You know, my job is to be consistent, clear, science-based as to the effectiveness. And I am open, we are open at EFA to hearing, you know, the range of opinions, and they are opinions, you know, based on their knowledge or their evidence. But I think we've just got to be very consistent and, in this time and post-COVID, respectful. You know, be honest, have integrity, and have the space, you know, for conversation. So, you know, that's my comment, and I thank David for his provocative question.
Thank you, Jane. And I think it would be, I mean, I think we should aspire to that. It feels like we're moving into a less and less open, respectful, and honest environment for conversation because of the stress, because of the structure. And I think that's what we have to figure out, is how can we bring it back? And I think individually we can do something by checking what we share, what we write, being extra careful, and basically sharing and bringing people into these conversations, because I think people have to be in the conversations.
Yeah.
I think if you just give up and say, oh my God, I can't stand this anymore, it's crazy, which, you know, you might feel like sometimes, I think that's dangerous. So I do think you have to go out there with good information. Now talking about out there, sorry, Jane, yeah?
Yeah, sorry, Phil. I just wanted to have a, make a plea to those that are on Twitter, etc., to actually shift from using social distancing to physical distancing, because social distancing implies something very different. And in the world that I live in with, you know, older people, social distancing is actually marginalisation, isolation, which leads to mental health issues. So let's try and change the language and use physical distancing. So thanks, Phil.
Thank you. Great suggestion. The issue is that it's taken out, because I remember having a conversation with people about how we could shift the words, and that's very difficult. So let's see, Lyra, have we got any other questions, any other comments on social media?
We do. Do we have time to pull someone else in?
I think so. I think we can. We still have a little bit of time.
Bear from ESNO, would you like to ask a question on camera? Bear, are you there?
So we're inviting Bear, and we're gonna turn him from a participant. Here he is. Hello, Bear. How are you?
Hi, Bear. Good to see you. I saw you had a question about platforms, and I thought it'd be nice to see you.
Yeah, I'm also a very Twitter user, and everyone is doing it. But my kids don't go on Twitter anymore, and sometimes I do think we have the expectations that we able to change policy by Twitter posts. So everyone is talking about Twitter, but we cannot change policy by Twitter. We have to, if you go into social media, you have to be in the broader context, and so that's why I'm a bit afraid. So as I'm a very promoter, and Bram knows this, Leora and Phil knows this very much. And education, explain it. Explain what is a virus. Don't be afraid, but know how to tackle it. There's also, if you are crossing the street, you know where to go. You go to look left, you go to look right, or even as a driver, you know it, because it's very dangerous. But if you know how to deal with this, then you create a kind of a sensible society. So and that also creates maybe also less fear, maybe also less anti-vaxxers, because you're prepared. You know how to deal with this. You see, when a child is born, the first bigger gift a child gets is the bacteria of mom, the bacteria of dad. So we shouldn't be afraid of bacteria. So that's why we have to deal with this. So there's also a kind of a new approach that we need to adopt. So now we have this COVID at the moment, and flu is a very good example how to address this with this herd community or with this herd vaccination. And then we know about when we learn about it. And it's also very welcome the word of Jane of the social distancing. Just know what it is. Just go have some more information and relax.
There, I saw that Gary already gave and answered your question already in the chat. Maybe Gary, you can also do it in real life.
Sure. Yeah. What was the? Oh yeah, about.
So the question is, should we not only use Twitter but also other platforms like Instagram or TikTok to reach our youth about vaccination?
Yes is the answer. I suppose very briefly that you find stakeholders, as we call them, and policymakers and experts and media on Twitter, and we're probably all there. But yeah, we're thinking of going to Instagram perhaps, and maybe TikTok to go for younger people. But obviously, you know, sometimes your audience isn't younger people, it's older people or middle-aged people or something else. And Facebook is still a really good platform for the adult audience. So so unfortunately it takes all these platforms. It's the only downside.
And I just want to say, I think actually TikTok has been surprisingly active in the vaccine conversation. I mean, WHO has gone to create videos on TikTok. Now it's a different language, it's a different style. And I think it looks very strange going in, but now you can see they have regular, very well viewed and shared videos explaining things. Now, Barry, you mentioned education and explaining, and I think you're actually touching on something very important, which is for us as a society to be able to deal with this, we need to have education for children in how to think scientifically, how to analyze data. And, you know, since all these kids are working from home remotely now, you know, wouldn't this be the perfect time to create online programs on how to analyze and understand online information, how to understand science, and how to understand COVID-19? I mean, maybe this would be the time to do it. Jane.
Look, thanks, Phil. You know, education is a very important conversation. But I think we've also got to remember that the poorest of the poor are paying the highest price. And so health literacy and the social determinants of health start playing in this area. And so when we're thinking education and online, what does it mean to someone living in Somalia, India, Bangladesh? What do we need to be doing so that we can actually educate them across all ages? So health literacy is actually very poor when it comes to vaccination. So I agree with you, but then how can we be innovative in this space?
Yeah, but just one small point on this. I mean, the countries you mentioned have some of the highest uptake of mobile and tools like WhatsApp. Actually, right. You know, fake news travels very fast, which also means it's a potential channel to reach with good information. So yep. I think the tools are there. And I think it might be that you need to direct the energy of creating the content, sharing it, and really making it excellent quality. And you could immediately already have an impact on millions of people around the world. Yep. Leora, back to you in the studio.
Hi, yes, I'm still here. So we have a comment from Marco from EPSA, that is the European Pharmaceutical Students Association, who actively advocate for immunization and vaccination. And they completely agree on social media and lifelong learning and continuous education. Thank you for that comment, Marco. We also have a question from Jesus. Jesus, shall we pull you in for this question? Jesus, are you there? Yes, he's coming. Hi. Well, we're ready for your question.
Can you hear me?
Yes, we see you.
Okay, great. Thank you for that. Well, first of all, thanks to the panelists for this great discussion. Very interesting. And for a while, I've been following this, and I see that actually there is, and Phil was kind of addressing this in some of the comments. I see there is always a battle between anti-vaxxers and pro-vaxxers. Anti-vaxxers that are quite flexible, they move quick, and they mainly have messages based on emotions, against pro-vaxxers that are more based on facts, and at the same time, like sometimes they don't have so much time to be there online. We see like a lot of doctors and healthcare professionals that could really bring all those facts up front, but at the end they don't have the time to be online as the anti-vaxxers are. So it looks like the truth is a bit slower. And at the same time, the anti-vaxxers seems to be much more efficient because they use mainly emotional messages. So I wonder if actually COVID-19, which is affecting to our everyday life in emotions, in the treats of people on being near one to each other, isn't it a good opportunity to bring this emotional part also in communicating in favor of vaccines? That is, thank you.
Gary, your thoughts?
Yes is the short answer. The longer one, we're always a little bit cautious. The advantage that those guys have is that they can hit and run. It doesn't matter what they say. There's no real accountability. And we have been warned a few times by some like psychologists that if it becomes a battle of emotional fear versus fear, that this can be paralyzing for people who have to make difficult decisions about whether to vaccinate themselves or their child or their parent. So we do try to do it a little, but we mix it a bit. So it's science plus stories, that's what we often say. But I think you are right that we should try a little harder on visuals and on emotion.
Great. I'll pass it back on to you, Leora.
Yeah, we have the results of the last poll we did. If you're interested, it was about mindset. So we asked, is COVID-19 a unique opportunity to change the mindset around vaccination? Well, almost everyone seemed to agree that yes, it is a once in a lifetime opportunity to change the mindset around vaccination. Thank you for voting. That was the last poll for the day.
Excellent. So I have a little kind of don't forget to tweet slide, which you'll see is quite nice. So you can use the hashtag Hyperchat to continue the conversation online. But what I'd like to do perhaps is to give our speakers a kind of opportunity to give their final thoughts before we end the conversation, this Hyperchat. And then we will be unmuting the audience so they can give a round of applause. Zoom is not ideally placed to do this, so bear with us. But I will maybe ask the speakers to give their concluding thoughts, just very briefly, just a final thought. I'll start with you, Gary, then Bram, then Jane.
Okay. Yeah. So I think this is an opportunity, but also we should be careful that things could slide back to just the way they were. So we have to work hard to sustain the bits we really want to keep, like the networks, like focusing on community, on healthcare professionals, and so on.
Thank you. Bram? I think we've lost your mic. We need you to unmute. Yep.
I agree. I think that's a good COVID-19 offers a good opportunity to help a different mindset in regard to vaccination, but we should never forget to have valid information, good information, and emotion is fine, but indeed not emotion against emotion. That's out of the question for me.
Thank you. Jane?
As the world is closing its borders, it is also uniting against the fight, with the fight against the virus. You know, now is the time to put public health front and centre and leave no one behind, including older people and those with underlying conditions.
Thank you. So I just want to say, I think there's been some really powerful insights from both the panelists, but also the audience. And I want to thank you for taking part. And of course, you know, this doesn't end now. because we continue the conversation on Twitter, on Instagram, on TikTok, for those who want to. We've posted a vaccine video on TikTok, by the way, one of our highest trending Twitter that I reshared. But no, I think, Gary, thank you very much for bringing, you know, the vaccines today perspective and this experience to the table, and to really share some of these great challenges that we're facing, especially when it comes to understanding the other side and understanding this environment. Bram, I think it was really very, very insightful to hear the difficulty we have with flu, where we have a vaccine and yet society kind of disconnects from that. And so we really need to remember this and to not just get sucked in to a narrative that just completely swallows up our attention, and we just don't have that perspective. And Jane, thank you so much for highlighting this incredibly important population that is being, you know, overlooked, sometimes neglected. Although, you know, we talk about protecting this population, sometimes it's actually the opposite that happens. So I think it's really important to keep bringing that back to the forefront of the conversation. Leora, thanks for the wonderful hypermoderation. I don't know if you have some final thoughts. I will now shift to our amazing slide to help the audience, because now you can clap to thank our speakers. So thank you very much. And if you have your mics on, feel free to clap. So, I think there's a mic canceling thing that happens as well with Zoom. So we're still working on it, but there's a lot of clapping out there. And please drop your thanks in the comments as well. So thank you very much. We are going to be putting this recording online. We're going to create a couple of clips from the webinar and just go online, keep the conversation. And I think it's really important for all of us to stay active, to produce good information, share it, and think before you post. I think that's probably one of the toughest things. So thank you very much. We will slowly close down the call, but like I say, we're officially closed, but people can stick around for a couple of minutes if they still want to jump. Since they have also their mics on, you can always shout a question that we forgot. But thanks again for all the speakers.
Thanks, Philip. Thanks. See you later, everybody. Bye.
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 Much. Bye-bye.